ACIP is getting serious pushback from independent groups. OTC birth control is helping those without insurance, and a continuous glucose monitor has been approved by the FDA for weight loss. That's just some of what we're talking about on today's RX Report, where you get your healthier news delivered. I'm your host, Manuel, and I'm coming to you from the home of pharmacy at the American Pharmacists Association in Washington, D.C. We've got a lot to talk about today, so be sure to leave a comment on anything that we talk about, like and subscribe to stay in the loop on all things health, and let's dive in. For our first story, let's talk about birth control. Access to birth control pills has historically been prescription only until around 2 years ago when an over-the-counter pill was approved by the FDA. Since then, a new study has found that many people who did not previously have access to birth control are using the over-the-counter option. But Mason, I hear you ask, why can't everyone just get a prescription for birth control? Well, my wonderful audience member that I made up in my head, going to a doctor can be harder of a lift for some people than others. According to this study's lead author, Dr. Maria Rodriguez, not having health insurance and residing in rural areas are two of the main barriers for people trying to access any health care. But pregnancy doesn't really care about that, so it can put a lot of people in hot water who may have otherwise chosen to be on birth control. So, how has this over-the-counter version changed things? The pill in question is called O-pill and costs roughly $20 for a month's supply, no prescription or age check necessary. You simply walk into your local pharmacy and buy a package. It sounds small, but this is a huge deal for those living in so-called contraceptive deserts where there are no contraception or primary care options within a reasonable distance. Generally, this means that those who are unable to live closer to more populated and affluent areas used to be more likely to be left in a contraceptive desert. But this new pill gives them a substantially powerful new option. In the study performed by Dr. Rodriguez and her team, they found that there was a 31.8% increase of people who had never used contraception before using it now with the OTC option. That means that over 30% of people who had been unable to reach a needed medication now have access thanks to this O-pill approval. And while over-the-counter pills like O-pill are opening doors, another way access is expanding is through pharmacists themselves. In many states, pharmacists can now prescribe hormonal contraceptives directly, making it easier for patients to start birth control without the extra step of a doctor's appointment. To help pharmacists prepare for that role, APhA offers a 4-hour online interactive training program that covers the different hormonal contraceptive options and how to safely prescribe, furnish, or dispense them in line with state laws. The training even meets the requirements in most states that currently allow pharmacist-furnished contraception. If you're curious, a link for that can be found in the description below. Until then, what are your thoughts around birth control becoming more available to the public? Do you practice in a state where you can prescribe hormonal contraceptives? Let me know in those comments. Our next story is stirring up a little drama in the vaccine world on the tail end of National Immunization Awareness Month. Recently, both the American College of Obstetricians and Gynecologists, aka ACOG, and the American Academy of Pediatrics, aka AAP, released recommendations for the COVID-19 vaccines, and they don't really line up with what the branch of Health and Human Services, HHS, CDC's Advisory Committee on Immunization Practices, aka ACIP, has been saying. Whew, that's a lot of acronyms. Look, for the TLDR on some of the places that these organizations have been split from ACIP, here is the gist. First, ACOG says all pregnant people should get the updated COVID shot no matter what trimester they're in, based upon credible evidence that it is safe and effective for people who are pregnant and their babies. According to a statement from ACOG, they recommend an updated COVID shot in, quote, individuals contemplating pregnancy and in pregnant, recently pregnant, and lactating individuals. This statement is in stark contrast to what the recent HHS announcement was, saying that COVID-19 vaccines will no longer be recommended for vaccines for pregnant women. Next, given available credible data and evidence to safely protect tiny humans who are the most vulnerable, AAP is strongly recommending COVID-19 shots for children aged from 6 months to 2 years. Additionally, they recommend shots for older kids as long as their parents want them vaccinated. For a reference of how monumental this is the first time in 30 years that the AAP has seriously diverged from the US government vaccine recommendations, and for most of those years, the ACIP has based their recommendations on AAPs. The HHS recommendations for reference are that healthy kids do not need to receive the COVID-19 shot, but they say that they can in consultation with a healthcare clinician, which includes their pediatrician or pharmacist. Now, you may be thinking between the brain fog of all those acronyms that this sounds confusing and hard to follow, and frankly it is. If you're worried about which guidelines to stick with, the HHS Secretary's statement does not change science-based recommendations to provide vaccinations to different age groups, and APhA recommends pharmacists continue administering vaccines under their state-based authority. APhA is also consulting with our partner Healthcare Providers Service Organization, which offers professional liability insurance specifically designed for pharmacists with coverage against malpractice claims and other professional risks. For pharmacists and other clinicians out there, continue to administer vaccines under your state-based authority in alignment with scientifically based recommendations to assure liability protections. To help navigate the very confusing waters here, APhA is partnering with the American Society for Pharmacy Law in a few weeks for a webinar to discuss how to approach decision-making and understanding liability when administering vaccines. Stay tuned for more info coming soon as we are officially in fall shot season. We'll get to our last story in a moment, but first, time is running out. You've got just 2 weeks left to submit your nominations for the 2026 APhA Awards and Honors Program. This is your chance to celebrate excellence across the profession, from outstanding pharmacists and researchers to leaders and innovators making a real impact. The deadline is September 8th, 2025, so don't wait, act now. If you need help crafting your submission, check out our video guide with tips for building a strong nomination packet. Let's honor those shaping the future of pharmacy. Submit your nomination today at pharmacist.com/awards. Again, that's pharmacist.com/awards. For our final story, living with diabetes is never easy, but there are some silver linings to this pancreas cloud, like the fact that only myself and my sugar-addled brethren can have these cool continuous glucose monitors. We can also show off our low to high blood sugars in real time to all the normies and enjoy the jealousy high. It's the little things, Surely nothing could ever ruin that though, right?
In today's health alert, the FDA has cleared the first continuous blood glucose monitor available without a prescription.
Well, yes, even though I was just praising the positives of how people could get birth control without a prescription, I am downright furious that you can now get a continuous glucose monitor, aka CGM, over the counter. I'm not actually mad, but how am I going to be cool now? I don't know. Anyway, this latest CGM has been made specifically for weight loss purposes. It's called Signos, and it uses an AI platform to offer real-time data and lifestyle recommendations for weight management. Think of it kind of like a personalized coach strapped to your arm. The idea is that by helping people understand how food choices spike blood sugar, even if they're not diabetic, they can make healthier choices that support weight management. Now, since these are over the counter, insurance doesn't cover it, so you can either get a 3-month plan for $139 a month or a 6-month plan for $129 a month. Now, that may sound steep, but keep in mind that prescribed CGMs like the one I'm wearing now can cost $1,000 a month outside of insurance. So frankly, Signos prices kind of sound like a steal. Now, it's early days, but this could open up a whole new category of digital health tools aimed at obesity, one of the biggest public health challenges in the US right now. PS for pharmacists, APhA is currently offering a certificate training program on clinical implementation of CGM in the community pharmacy, which equips pharmacists with the knowledge and practical skills to bring CGM services into their practice. So, if you're curious, check out that link in the description below. In the meantime, I've got to ask, do you think this new competition will make legacy CGM companies innovate more, or maybe even lower prices? What are your thoughts on CGMs being available for people without diabetes? Let me know in those comments. And that is our show. If this episode made you want to be as cool as a diabetic, then click that like and subscribe button to get more RX Report. Be sure to let me know what you thought of this episode. Agree or disagree, I would love to hear from you. Our executive producer is Rob Hodges. Our creative producer is Kate Erdmann. And until next time, I've been your host, Mason Manuel. Be sure to tune in next Friday for more RX Report, where you get your health, your news delivered, and check out pharmacist.com/podcasts for more APhA content. But till then, bye y'all.